So most patients don't have symptoms related to prostate cancer. The vast majority of patients with prostate cancer that we identify because of an elevated PSA, the blood screening test for prostate cancer. I strongly recommend all men, age about 50 to 55 up through 75, to have an annual PSA to screen for prostate cancer. You can have a high PSA and not have prostate cancer, and so not everybody with an elevated PSA has prostate cancer, but if you have an elevated PSA, that usually means that you have an increased risk for having an underlying prostate cancer. If you're African American or have a family history of prostate cancer and a father or a brother, then we might start screening earlier in patients with those histories. If we do find an elevated PSA, sometimes there's additional testing that we would do prior to coming to a diagnosis. The only way to diagnose prostate cancer is to get a piece of prostate tissue out and look at it under the microscope with a biopsy, and that's generally very well tolerated. So I would have a low threshold to suggesting that if that's going to make a big difference, because I certainly don't want to miss a prostate cancer that could affect your quality and quantity of life.